My name is Matthew Anderson, and I am Chief Neurosurgery Resident at Rhode Island Hospital, Brown University. So, I guess I got interested in neurosciences as a child. One of my friends from elementary school, his mom was a pediatric neurologist, and she used to bring in brains to after-school programs, and I was very fascinated by that. One of the men at my church, who was also a physician, saw that I was really interested in science and math, and also saw that I had a lot of energy, so he told me to become a doctor. And then in middle school, a woman from my church watched Dr. Ben Carson's ABC special and gifted me a copy of his book, Gifted Hands. And I learned a lot about, being a doctor and how to get there, and that got me interested in being a neurosurgeon. And then again in high school, I did a project on Huntington's disease because I had this interest in the brain, and that got me very interested. And I in my mind, thought neurosurgeons took care of Huntington's disease, which they do not. But that kind of sparked my interest in the field. And so I shadowed in college, and then I also did research on spinal cord injury, and that continued my fervor. And then in medical school, I did research on intracerebral hemorrhage and peripheral nerve regeneration, and now I'm here. I had initially wanted to be a pediatric neurosurgeon, and then I thought maybe tumors, and now I'm going into vascular neurosurgery, and I couldn't be happier. We have our sign out at 6 a.m. and sign out means that's where we kind of go through all the patients, talk about the plans for the day and what we think what has happened in the day before and what we think should happen in this coming day. And that usually lasts until about 7:30. Our initial OR start at 7:30, so we have to kind of rush down to the OR. And I could be doing any number of things. I could be doing a spinal fusion. I could be doing clipping an aneurysm in the brain. I could be taking out a brain tumor. I could be decompressing a peripheral nerve in someone's hand. One of the cool things about neurosurgery that I love is that there are so many things that you can do within the nervous system. And so there are many different ways to be a neurosurgeon, and so it gives you a lot of options when you are trying to choose what you're going to do. So as a vascular neurosurgeon, a lot of the things that I'll be doing have to do with the blood vessels. I'll be taking care of them both through craniotomies, which is where I take off part of the skull and I have to either clip an aneurysm or I have to resect a malformation of the blood vessels, or I'll treat them endovascularly, meaning that I will put a small tube in either the arm or the leg, and I'll feed that up to the blood vessels of the brain, and I'll take out clots because someone's having a stroke, or I'll put a coil into an aneurysm that is either ruptured or we think has the possibility of rupturing, or I'll put glue into those blood vessel tangles, the malformations that I was talking about, so that we can decrease the blood that's going to it. As much as I love neurosurgery, I also have a life outside of this place, or at least try to have some semblance of a life outside of this place. Some people would say that I don't really have a life, but it's fine. I enjoy hiking, I enjoy running, I lift weights fairly regularly, I like to cycle, and I love to travel. Whenever I have a week off, I always try to go somewhere, whether that be domestically and, to the different national parks, or internationally. And, I've climbed Kilimanjaro during my residency. I've gone to Italy and Australia. And, I really think that for me, that is something that brings me joy. And so, even if you are a neurosurgeon, there are things that you can do to kind of supplement your life to enhance it and make it whole. So one of the things that I really like about my job are honestly the connections that I make with my patients. You know, a lot of people, when they come to me, they have a critical illness, and you know, you have to kind of walk them through that, what it means, what things we can do for it, what things we can't do for it. And you know, my patients, you know, really help me to understand why I'm doing this. I can remember there was a black parent actually that I saw, and his kid had hydrocephalus, which essentially just means he has a lot of water in his brain, and we don't want a ton of water in our brain because that can make us sleepy and it can cause increased pressure in our head. And I had to take care of his son, and I would see him every night that I was on call. And his dad worked, you know, during the day, and he was only able to come at night. And so whenever I went in to see him overnight, he wanted to have like a whole debriefing of what, you know, happened. And in many ways, I'm like, oh, I don't have time for this. But I always sat down and talked with him because I could tell he was concerned, and I wanted him to feel comfortable. And I saw him actually a few months ago, and he said that the time that he had with me, explaining to him every day the things that were going on with his son, were some of the most important days of his child's early life, and he really appreciated that. And that really meant a lot to me because, you know, we get busy, and you know, there are times where I'm like, I just want to get, you know, all the things done because I have a lot of patients. But I'm doing all of this for my patients, and I think that the connections that I make with my patients is really what keeps me going, because I know that if I'm able to provide the best work for them, if I'm able to connect with them, if we're able to come to a collective decision on what to do, then I'm doing this for the right reason. None of my family is in healthcare. You know, my mom's an accountant, my dad was a police officer, and you know, I tell them about the things that I'm doing, and a lot of the times they don't understand, and that's fine. You know, they're just proud to see me doing what I do. But one of the things that my dad always kind of instills in me, you know, I say, oh, I clipped an aneurysm today, oh, I took out a tumor today, and he's like, how's the patient doing? And I think, you know, in many ways, you have to remind yourself that, yes, you can be doing really cool things and really amazing things, but really what it's about is the patient. And we can't forget that. And I think, you know, as you go through your medical career, putting the patient first and not your ego, not, you know, your research, not your, you know, whatever it might be, putting the patient first is of utmost importance because this is why we do it all. With any job, there are going to be challenges. You know, I think there are specific challenges to neurosurgery, and then there are, you know, challenges within the medical field as a whole. You know, I think as a neurosurgeon, sometimes it can be very hard to deal with bad outcomes, you know, and that is just the nature of the job. And there will be times when there are bad outcomes, and you need to find ways to kind of deal with that. And so for me, one of the things that I always do is I go through the case, and I go through what are the things that I think went well with the case, what are the things that I don't think went well with the case, so that in the future I can use that knowledge to apply it to future cases, so that, you know, not that I won't make other mistakes, but that I hopefully won't make the same mistake twice, though that will happen as well. But it helps me to make sense of some of the bad outcomes. Sometimes the bad outcomes, there's nothing that I could have done differently. And that's important to know. You know, if I know that I'm doing the right thing for the patient, I would have done nothing differently. That's important for me to know as well, because that tells me I'm doing it the right way. But if there is something that I need to change, then I'll change it, and I'll make sure that, you know, I'll do my best to not make that mistake again. I think, you know what, one of the biggest things with just healthcare as a whole is I think we don't do a great job with wellness and making sure that we are taking care of ourselves. You know, as much as we want to put the patient first, if we are not taking care of ourselves, we're not putting the patient first, right? If we're not getting enough sleep, if we're not eating well, if we're not exercising, if we're not seeing our friends and family, and that is going to be different every day, but if we're not doing those basic things, then we're not putting the patient first. Because we're not giving our best selves to the patient, and therefore we're not putting ourselves first. And so I think that that's something that we as physicians are starting to focus on more, and I appreciate that. And but I do think that we have long strides to go. So, we're at this conference, Black Men in White Coats, and, I think it would be remiss of me to not talk about being a Black male neurosurgeon. It has its challenges, but there are also rewards, I would say. I think certainly one of the challenges is there are times where I'm not taken as seriously, or I'm not even seen as a physician, or even someone on the medical staff. There was a time when a patient asked me why the cafeteria man would be doing his exam, because he thought that I was just bringing him his food for the day. Or there have been times when patients have said that they don't want to, talk to a Black provider. And you have to deal with that, and that is going to happen in your career. But there are also times when it's rewarding. When I see my Black patients, I've had many Black mothers say, "Oh, I just really love that you're here. I love that he's seeing a Black physician. I really love that you're able to connect with us in a way that other physicians haven't been able to." I remember my first year, and that's when you spend a lot of time in the ICU. I would see my patients. I'd talk to all my patients, and I would see them every day. And one of the patient families, they were a Mexican family. They were actually from California, but they were visiting Rhode Island. And I would see her every day. The family wanted to hear what I had to say as an intern over what my attending neuro intensivist had to say, because they didn't feel like he was connecting with them. And, of course I had to let them know, I'm like, I was an intern. I have things to say, but he definitely has more experience with this. But it spoke more to the fact that I was able to connect with them in a way that he was not able to, whether that be culture or, just his, kind of demeanor. But I do think that, being the Black physician also has its perks and its benefits, and those are some of my things that I love about my job. So good luck with everything. Honestly, I think that medicine is honestly a very rewarding career. As challenging and as taxing as it can be, it's also very rewarding when you see your patients doing well. You see the fruits of your labor. You get to put all of that science and math and all that stuff together to help someone, and it really is rewarding to see those things, and it's cool to see that all your hard work has paid off. So best of luck. If you have any questions, I'm here, and I would love to help anybody that would like to go into neurosurgery or just medicine as a whole.